Welcome and thank you for your interest in joining the Wisconsin Coalition for Social Connection. We're extremely grateful that you're here and interested in learning more on how to build thriving communities through connection. In this video, you'll understand a little bit more on the background and research of social isolation, loneliness, and social connection. We will describe the process and a little bit of the history of the Wisconsin Coalition for Social Connection and how we were able to grow a statewide social connection coalition and network. And finally, you can learn how to get more involved and identify strategies to increase awareness of social connection as a public health need. Though sometimes used interchangeably, social isolation and loneliness are different. Social isolation is the objective measure of the number of relationships and contacts that a person has. So this means that they are isolated, they are physically separate from other people, and this might not be unpleasant for the person. They may actually choose to isolate and have limited social contacts. Loneliness, on the other hand, is a subjective feeling about the gap between a person's desired levels of social contact and their actual level of social contact. So they feel isolated. This really can be distressing for someone and can be felt regardless of social contact. So you can feel lonely in a room full of crowded people. If you're in a room full of crowded people, you're not isolated. So those are the differences between the two. On the flip side of that, we have social connectedness and belonging. So social connectedness refers to the degree to which people have and perceive a desired number, quality, and diversity of relationships that create a sense of belonging, being cared for, valued, and supported. And belonging really is a fundamental human need. We need to feel that feeling of deep connection with social groups, physical places, and individual and collective experiences. So when you think of belonging, think about where you feel your most authentic self. And this varies for everyone. It could be around family, faith groups, friends, whatever it might be. We know that decades of research has produced evidence that lacking social connection, and in particularly scoring high on measures of social isolation, is associated with a significantly increased risk for death from all causes. Isolation and loneliness isn't new, but it's now recognized as more than just a sad circumstance. It really is a public health problem with very real physical, emotional, and psychological health impacts. In 2023, the U.S. Surgeon General, Dr. Vivek Murthy, released an advisory outlining the scope and the health impacts of the problem, along with a series of strategies for addressing it. In the United States, we weren't the first to recognize and act on this as a public health issue. The UK and Japan each have cabinet-level ministers of loneliness. The World Health Organization has also raised alarm bells about the impact worldwide. And in the US, there have been studies that have revealed the deep value of social connection. We highly recommend, if you haven't already, taking a look at the Surgeon General's report, Our Epidemic of Loneliness and Isolation. I'm not going to spend too much time on this, but there are different things that can make a person more or less susceptible to loneliness and isolation and lack of connection. We can often break these out by different categories. So individual, relationships, society, and community. There are many different things that can impact a person's level of isolation and loneliness and really increase their level of, or decrease their level of social connection. You might be wondering how social connection influences your health, and it really does in a pretty significant way. Research shows that people who lack connections experience serious health impacts, including an increased risk for heart disease, stroke, dementia, depression and anxiety, and even an increased susceptibility to infectious disease. Lacking social connection is as dangerous for your health as smoking up to 15 cigarettes a day, which is very significant. So this can impact your biology. Having few connections increases stress hormones, inflammation, and gene expression, which is the process of turning DNA information into a function in the body. It impacts your psychology. It can have a negative impact if you have few connections on your meaning and purpose. It can increase feelings of stress and decrease feelings of safety. It impacts your resilience and hopefulness or outlook. And then it can also impact your behaviors. So lacking social connections decreases the likelihood of healthy behaviors such as physical activity, good nutrition, good sleep, accessing healthcare, and actually increases negative health habits like smoking. The cumulative effect is the negative health outcomes that I mentioned. We do have additional Wisconsin and national data related to how social isolation and loneliness impacts health on our website. This loneliness impact pyramid framework was developed by our coalition in 2022 and serves as a guide to better understand solutions to social isolation and loneliness. So as you take a look at this, I really want you to ask yourself how you can see yourself or your organization or people that you're connected with building social connection for older adults and people with disabilities.
The Wisconsin Coalition for Social Connection, formerly the Wisconsin Coalition to End Social Isolation and Loneliness, was formed at the end of 2020 in response to the increasing rates of social isolation and loneliness due to the COVID-19 pandemic, as well as emerging evidence of the negative health outcomes associated with it. The leadership team initially included the Bureau of Aging and Disability Resources at the Wisconsin Department of Health Services, the Wisconsin Institute for Healthy Aging, AARP Wisconsin, the Greater Wisconsin Agency on Aging Resources, UW-Madison's Division of Extension, the Wisconsin Association of Senior Centers, and went on to include the Board for People with Developmental Disabilities, among others. The mission of the Wisconsin Coalition for Social Connection is building a diverse network of people and communities across Wisconsin to live healthier and more socially connected lives. Our target population of older adults and people with disabilities was determined based on the lead members' experience working with those populations, and because there are existing efforts already focusing on other populations throughout the state. Our coalition uses a collective impact approach to bring together community organizations and individuals to identify and deploy meaningful responses to the negative health impacts of social isolation and loneliness among older adults and people with disabilities in Wisconsin. Since then, we've grown to include over 700 individuals representing numerous organizations, and our major activities include raising public awareness of the impact of social connection, detecting and responding to those experiencing or at risk of social isolation and loneliness, curating research, data, and interventions from local, state, and national partners, and developing policy initiatives and advocacy efforts. As with any coalition, our work has ebbed and flowed over the last few years due to things such as funding and staff changes and shifting priorities. Initially, we had ongoing work groups that focused on the coalition's goals of raising awareness, access, and detection, research, policy, and equity. We currently have 2 committees that meet monthly and occasionally have shorter-term ad hoc committees for other projects, such as engagement or data collection and measurement. The Awareness Committee shares ideas, initiates, and is involved in campaigns that raise awareness of the impact of social connection and the negative health impacts of social isolation and loneliness. They coordinate educational and awareness-raising events and activities during Wisconsin's Social Connection Awareness Week each November and participate in Global Loneliness Awareness Week. The Policy Champions Committee aims to support and influence policy that increases social connectedness for older adults and people with disabilities. They provide recommendations to the decision-making team, who then makes the final decision and shares that information out with the coalition network to advocate and take action on. Our coalition leadership meets monthly, and we hold every other month webinars for our other network members. We make an impact by leading initiatives that provide avenues to engage with each other and the Wisconsinites we serve. We share resources from local, state, and national partners, and we serve as a clearinghouse for best practices and tools for outreach, community, and advocacy. Our coalition has been fortunate to function on in-kind support from the coalition lead organizations and active network partners. We have been successful because those of us at the table share a deep understanding of the negative health outcomes caused by social isolation and loneliness. Our organizations have a shared mission and goals to increase social connection among our target population, and we have the desire to work collaboratively to expand our reach and impact across Wisconsin. Throughout the history of the Coalition, we have received funding from the RRF Foundation for Aging, the Wisconsin Department of Health Services, Bureau of Aging and Disability Services, and the Rennebaum Foundation to support specific initiatives and functions of the Coalition.
Since the Coalition formed in late 2020, we've achieved many accomplishments, including changing our name from the Wisconsin Coalition to End Social Isolation and Loneliness to the Wisconsin Coalition for Social Connection. Along with that name change came a new logo, brand development, and a new website launched in May of 2024. Another accomplishment is the bi-monthly network meetings that we hold, in which we share information and resources with the network, including Wisconsin Spotlights, resources and connection opportunities, webinars, articles and reports, research materials and content, and advocacy events such as Disability Advocacy Day, Aging Advocacy Day, Alzheimer's Association Advocacy Day, Healthy Aging Summit, and Suicide Prevention Month. We've also added questions regarding social isolation and loneliness to participant evaluation forms for the Strong Bodies and Aging Mastery programs in Wisconsin and the Wisconsin Institute for Healthy Aging programs. Currently, data is being evaluated to determine the role that high-level evidence-based programming plays in reducing social isolation and loneliness. The Coalition's only long-term committee at this time is the Policy Champions Committee. This committee first met in October of 2024. The committee's purpose is to make decisions on supporting policy initiatives that increase social connection for older adults and people with disabilities, as well as to provide resources for our coalition to act on policy and advocacy efforts. Earlier this year, the Policy Champions Committee recommended that the Wisconsin Coalition for Social Connection sign on to the Protect Medicaid letter circulating in the state. The Policy Champions Committee saw the changes proposed for Medicaid as having a significantly negative impact on the lives of older adults and people living with disabilities, as cuts to the programs they rely on for essential care and daily needs could be eliminated or restricted, making it difficult, if not impossible, for them to stay living in their own homes and connected to their communities. The committee is currently brainstorming and discussing policies related to support for increased access to long-term services and supports, communication best practices, the Lifespan Respite Care Act continuation, voting access, elder abuse and abuse of vulnerable adults prevention, and other policies related to the built environment, such as access to and affordability of broadband services, transportation, and housing.
The main purpose of our Awareness Committee is to plan for Wisconsin's Social Connection Awareness Week, which is held in November. We also participate in activities during Global Loneliness Awareness Week in June, and our Awareness Committee meets monthly to plan for the activities for these 2 weeks and to discuss and implement initiatives to raise awareness of the benefits of social connection year-round. In addition to holding webinars during Social Connection Awareness Week, we also secure a governor's proclamation, develop a social media campaign, and put together newsletter articles, press releases, and other activities that our coalition members and network can participate in during Social Connection Awareness Week.
The Coalition has several ways to support you, and one of them is providing you with the evidence-based screening tools to identify loneliness and isolation, as well as for measuring your intervention's impact. Our coalition has experience using the UCLA 3-item loneliness scale, and we encourage you to use the Foundation for Social Connections Social Connection Measurement Tool Inventory to find the measurement resource that most closely aligns with your purpose. Consider how you currently screen and measure impact, and how you might be able to improve. New tools are always emerging. Check back to this page for the most up-to-date information.
Some great ways to stay engaged with the coalition is to connect with and share information through our newsletter, social media, and website. If you're really good at these things, you can even offer to help or share information on things that you or your organization have going on to send to our statewide network. In addition to all of the other great opportunities that the coalition offers for collaboration and engagement, we also hold learning opportunities throughout the year as topics come up that we're interested in learning more about, or as opportunities arise that our network members are wanting to share. On the screen, there are just a couple examples of these learning opportunities that we've held in the past. One about mental health for older adults, and another about a program for those with memory loss and their caregivers. We've also hosted webinars on social prescribing and other topics. Wisconsin-based project that's important to mention, as it heavily relates to Wisconsin's commitment to reduce social isolation and loneliness for older adults and people with disabilities, is the American Rescue Plan Act grants that were awarded in 2024. 37 ARPA grants totaling almost $3 million were awarded throughout 42 counties in Wisconsin to reduce social isolation and loneliness and enhance livable communities. Grantees created or enhanced 23 coalitions for the purpose of project guidance and working together to reduce social isolation and loneliness and promote livable communities. This amazing work was accomplished in a 10-month period during 2024 and 2025, and all of the projects are continuing to some degree. You can find more information about the projects on our website, and as you get more involved in our coalition, you'll hear about and get to meet some of the organizations that continue to be engaged in this work. There's a lot of great work on this topic being done nationally as well. We are a member of Commit to Connect's nationwide network of champions, and we encourage you to join that as well. And we've connected with other national organizations like Healthy Places by Design and the Foundation for Social Connection, which have all been excellent resources. Thank you so much for taking the time to learn a little bit more about our background and the research and history behind our coalition. So next steps, you'll be added to a listserv after you fill out our membership form. If you do check that you're interested in joining a committee, a coalition member will be in contact with you. But in addition to that, consider how you can play a role and raise awareness. Personally reach out to family, friends, neighbors, coworkers, and provide that meaningful connection for others. Definitely check out our Facebook page at facebook.com/connectwi and our website as well. We have tons of great resources on there for older adults and people with disabilities, and also professionals working in the field. You can check that out at connectwi.org. Again, thank you for being involved and for promoting social connection for older adults and people with disabilities in your community.